the high risk pools. Okay, here is Paul Ryan explaining the high risk pools, and the reason why I want to go through this is going to be a little bit belabored, folks, but this is really, really important for you to understand when you hear this stuff why it's bullshit. Okay, because high risk pools existed in this country starting in 1976 up until the Affordable Care Act. They were, as of 2010, they were in 34 states across the country. They had various different rules about them. The most successful supposedly was in Minnesota. Here is Paul Ryan talking about these high-risk pools. So here's the lie, and then I will tell you the truth of these high-risk pools and why Paul Ryan's plan is bullcrap.
State high-risk pools are a smarter way of guaranteeing coverage for people with pre-existing conditions. We had a really good one in Wisconsin. Utah had a great one. I was talking with a congresswoman from Washington today who was telling me how good their state high-risk pool is. What I mean when I say this is about 8% of all the people under 65 have that kind of pre-existing condition. My mother-in-law, cancer, she had melanoma in her 20s, breast cancer in her 50s, ovarian cancer in her 60s. People just have these things. And we don't want people to go poor or bankrupt because this thing happens to them. So we obviously want to have a system where they can get affordable coverage without going bankrupt because they get sick. But we can do that without destroying the rest of the healthcare system for everybody else. That's the point I'm trying to make. What we should have done was fix what was broken in healthcare without breaking what was working in healthcare, and that's what, unfortunately, Obamacare did. So, by financing state high-risk pools to guarantee people get affordable coverage when they have a pre-existing condition like yourself, what you're doing is you're dramatically lowering the price of insurance for everybody else. So if we say, let's just as taxpayers, and I agree with this, finance the coverage for those 8% of Americans under 65 in a condition like yours, they don't have to be covered or paid for by their small business or their insurer who's buying the rates for the rest of the people in their insured pool, and you dramatically lower the price for the other 92% of Americans. Let's just directly fix that so that everybody else can get more competitive rates and they don't have to pay for insurance to try and cover for those kinds of really expensive people. The problem with Obamacare, the actuaries call it a death spiral. It's a really kind of ugly, gruesome term. But a death spiral is a mathematical term. They say when the insurance gets so expensive, healthy people won't buy it because it's just a trade-off. The penalty to not buy it is a lot cheaper than buying the insurance, so healthy people won't buy it. Therefore, they won't go and participate in the insurance pool to cover the losses that sicker people who have to have insurance buy it. That's what's happening to Obamacare now. So you have unhealthy people more buying it, healthy people not buying it, and that is why the rates are going up so much. That's why all the insurers are pulling out. Biggest health insurance company in the country last year, United, pulled out of Obamacare. Aetna pulled out of Obamacare. Humana pulled out of Obamacare. As I mentioned, 5 states now are down to 1 insurer. Over 1,000 counties in America are down to 1 insurer, and they're all getting double-digit premium increases because they have a monopoly. So clearly that's not working. And we see the worst is yet to come. The insurers are telling us they're going to pull out of whole states now. So we've got to step in front of this problem because as Republicans, we could just say, I think the president-elect said this yesterday, we could just sit back and watch it all happen and say, oh, look at what the Democrats did. That would be irresponsible for us to do that. So we have to step in and rescue people from the collapse of this law. There are good objectives that they sought to achieve in this law. We agree with that. We think young people, you should be able to stay in their parents' plan until they're 26. We think there needs to be a solution, which we have, for people with pre-existing conditions. But we want more choices, lower prices, more competition, no monopolies. That's what we want to replace it with, and that's what we're working on.
Okay. So he's talking about 25.
So much bullshit.
Well, okay. Let's break down this, okay? The problems that he was talking about with the Affordable Care Act were more or less accurate. For the time being, let's just stipulate that, okay? There was problems in the exchanges. Health insurance companies do not want to participate in the individual insurance market. The vast majority of them don't want to do it. They're forced to do it because they want the group insurance business. When they participate in the group insurance business, it's not even their money. It's the company's money. They self-insure, and what the insurance companies do, they just administer it. let's just but the problems with the individual market are correct to a certain extent, and it certainly we all know that the Affordable Care Act did not make insurance broadly affordable.
Right.
Here's where Paul Ryan's lie is.
Call it as affordable as it should be.
Right.
And there's a number of reasons for that, which we can go into.
But let's not argue over let's just stipulate there are problems with the Affordable Care Act. Here is where Paul Ryan's big lie is. These state risk pools. The reality of these state risk pools is that when you had 34 states who were implementing this for over the course of those 30 years, up into 2010, there were only 200,000 people who participated in it at an annual cost of $2 billion. There are 4 million Americans who are actually eligible for this. Most of those people couldn't participate in those risk pools because the costs were too expensive. Even with the cost associated with those risk pools, in terms of what you had to pay for premiums, you had to wait sometimes between 2 and 12 months to actually get into those risk pools. So a lot of people, if they get, like this guy with cancer, if he gets cancer and he's got 6 weeks to live, he's going to die. That guy dies. That guy dies. On top of that,
and it's important to keep saying that, because sometimes we don't give, there's not as direct a correlation from A to B, but it's very simple here.
Now he's saying 8% of 60,
will die.
He's saying 8% of people under the age of 65 are eligible for these pools. I've seen figures that around in 2011 it was 4 million people. So it's at least 4 million people. The cost of providing, and they're offering $25 billion over 10 years, $2.5 billion a year to subsidize these high risk pools when it costs $2 billion for 200,000 people. So people can do the math here. It will cost, according to an article in the Journal of General Internal Medicine in 2011, it would cost at least $24 billion a year to do these high risk pools. $24 billion. They are shortchanging it by 10 times a year. And this is in 2011 numbers. We're now 8 years out from that, 7 years out from that. This is what they're going to do is they're basically just they're just taking people's health insurance and they're putting something up there that is a total lie. People have to understand it. If they were to fund this at 24, 25, $30 billion a year, yeah, that could work. But good luck with that, because the moment they repeal the Affordable Care Act, they're giving a huge tax cut to people who are making over $250,000 a year that has been financing the expansion of the Affordable Care. Never mind Medicaid and whatnot. So this is just
think we should be forgetting about people at the bottom who can't afford to get into to get health insurance. If you are in that kind of situation, the best one to give is that gentleman who he lied to. It's just simple. You will die. And there will be a couple 100,000 people like this, at least, will kick off of health care who will not be able to get it and will die. And that's all this is. It's directly related to the policies that these guys are taking up. It's a straight line from A to B here. And, anything they complain about with the Affordable Care Act, as we've, Social Security, Medicare, many other programs we've passed, and no one program has ever been passed and fully implemented as it currently is, from the start, right? Social Security didn't have survivor benefits and didn't include domestic workers for racist reasons and other things of that nature. So it's this whole time the Republicans could have been working with President Obama, working with Democrats to make this better, to make this something that helped cover people. I mean, there was a vote, and a number of Democrats were bad on this and should be called out for it, on reimportation of drugs from Canada.
Yep.
That is one way you'd bring down prescription drug prices. Under Medicare, you can we're the only place that refuses to allow bulk negotiation. By our big government entity. We won't. I mean, that's insane, because this is what the free market should be if you really believed in that kind of thing, which a lot of Republicans claim to. So we're not making it as cheap as possible, and we're doing that on purpose, because they want this thing to fail. That's all this comes down to, and they've always wanted it to fail, and they've never tried to make it better. Is it perfect? No. Are we all, I think, listening to this right now in favor of single payer? Absolutely. But it was a road to there, and if these guys were willing to improve upon what was passed, healthcare at this point could be cheaper. Even more people could be included. This is something we know how to do. You cannot do it without the government's willingness to spend some money to help people who are less fortunate, which in a democratic society, when we all agree to live together in some sort of a commonwealth, should be something you believe in. It's just that simple.
And at this stage, the thing that people have to remember is that what they're hearing is fundamentally a lie. The Republicans are not interested in replacing anything. If they felt they could get away with their own voters, allowing them to basically go back to where we were, and in fact, even roll back the risk pools, the state risk pools, they would do it. But I monologued there a little bit, Cliff. But I wanted to get this out there because this is something we've got to hammer.
Important.
Yeah.
And I'll just say, the two other things, and this is what everybody else is forgetting too, which is hilarious considering what Republicans say they're in favor of, is at this point also eliminating Obamacare is going to cost tons of jobs, and it is also going to blow up the deficit. So, and I shouldn't say blow up, that's sort of Republican scare quotes kind of stuff, but it will add to the deficit. There's really nothing, there's nothing where you could sit there and say this is a great reason why this should be repealed. There just isn't. And everything else they say, again, any problem they can find with this is something that could have been fixed, could have been helped along.
Not even could have, could be. Right? I mean, they could.
No, still could, exactly. But I could have, I meant, when it came out, if they'd wanted to make it better, if they want to, clearly they don't, and as a party, they never will.
Hey, it's Sam Seder. Why don't you subscribe to this channel? You can do so right over here. Over. Subscribe.